Welcome to A People's Response to the Coronavirus Crisis, sponsored by Freedom Road Socialist Organization. I'm Steff Yorek, Political Secretary of Freedom Road, and I will be moderating today's panel. I wanted to welcome all of you and let you know the format today. People have provided their speeches in a video format, which we will show first, and then we'll be joined by the panelists live to take your questions via YouTube live chat. The world is currently overwhelmed with the pandemic. COVID-19 is spreading across the globe. This virus, which passed into humans in Wuhan, China in January, causes serious disease in some people and not so serious disease in others. The statistics are that about 80% of people who get the virus have a relatively minor course of disease. 20% of people who get the disease will suffer more serious consequences, and that means that they need to go to the hospital. Once China realized the seriousness of the situation, they did a good job of working hard to contain the virus and keep it from spreading in the world. They should have given the United States 2 months' time to prepare for the coming of the pandemic. Instead, the Trump administration and U.S. Capitol was more concerned about their bottom line, how the economy might be impacted by slowing things down in order to stop the spread of the virus. And instead of preparing our hospitals, transforming more beds into ICU beds, manufacturing and sourcing personal protective gear for healthcare workers like masks, gloves, and gowns. They spent all of their time downplaying the seriousness of the virus. And now we're in the situation we're in, where we have a global pandemic on our hands. By the end of this weekend, more than 500,000 people will be infected with COVID-19, and 25,000 will likely have died. We can expect disease to expand, especially if we don't consistently implement social distancing measures and try to stop person-to-person contact in order to stop the spread of the virus. A virus is a natural phenomenon, like Hurricane Katrina or Maria or Rita. That is a phenomenon that is out of human control. But the response to that phenomenon easily turns a natural phenomenon into a man-made disaster. And we are at risk of that happening with the COVID-19, the coronavirus. When we have lieutenant governors arguing that people should be willing to die so that the economy can remain strong, we know that we can't trust our leaders or the capitalists that they represent to have our best interests at heart. We need to continue to fight for and make demands on government that protects both the health and safety of our healthcare workers, our elderly and our immune compromised, and also the livelihood and right to live a stable and secure life for all workers and oppressed peoples in this country. So I want to welcome our speakers tonight. We're going to have video of them that they've given to me in advance, and then later they will join us live for a panel discussion. We'll be taking questions via YouTube Live, and I really look forward to hearing from everyone and having a lively discussion about how we can continue to fight back in the face of a global pandemic.
Good morning, comrades and friends. I want to speak about the pandemic crisis that we're all facing today. And since it's had such an impact on me, I prepared some remarks, because if I spoke extemporaneously, I could just go on and on. Already when the coronavirus first hit, we were in a health crisis where millions did not have health insurance, and emergency rooms in poor urban areas were filled with black and brown people. Already we were hit hard with unemployment in black communities, with that being twice as high as in white communities. Already we were disproportionately represented in the 140 million living in poverty, in the 500,000 who were homeless, and the millions in jails and prisons when the pandemic crisis hit. So as death stalks the land, we are clearly the most vulnerable populations, the most untested, untreated, and the most concentrated in the cities, jails, and prisons. The coronavirus is not prejudice. It infects and kills human beings. But those who make policies, that is, the powers that be, are often the greedy and racist, like Donald Trump. This is why we, that is, those of us who are the most vulnerable, must organize and make our voices heard. We must demand testing and treatment in our communities. We must demand testing and treatment in our communities for those in jails and prisons. We must also demand the release of prisoners who have been wrongfully convicted, who are terminally ill, and those who have grown old in prison. Already in Cook County Jail, they have started to release some low-level cases. We must demand that they release all such cases and prisoners who are being held only because they are too poor to make bail. The Senate has passed a $2 trillion economic relief package, but not with input from us, the most vulnerable. So we understand why this bill gives the least to those who need the most, and the most to those who need the least. The greatest obstacle to moving forward and fighting this government is the fact that the government is doing virtually nothing to protect our healthcare workers and all workers who are needed in this fight for our lives. Thank you.
Local demands that affect Boyle Heights or the east part of Los Angeles. And those demands are against police brutality because in 2016 they killed over 8 of us. And of course, winning public education to be the best education that it can be, and against privatization of it, and also legalization for all of the undocumented. There are creative ways that we are thinking of doing in order to make sure that we can still win these demands. And some of those are to ask people to send us selfies with whatever campaigns we're doing locally. Also doing propaganda work. They're not limiting us locally in doing exercise. So what we're thinking of doing is actually jogging to a particular site and putting up posters, as we normally do around International Workers' Day, for example, or around the 50th anniversary of the Chicano moratorium, which was something that happened in 1970. It was the biggest anti-war protest against the Vietnam War that ever took place by oppressed nationalities, Chicanos, in the eastern part of Los Angeles. And so we're going to be celebrating it this year. So we are thinking of doing propaganda work in that manner, where we just jog to a site by ourselves because we can't be in groups, and of course being safe about that as well, and putting them up. We're also going to be doing educational webinars and meetings in that manner, and using all of our social media that we can in order to make this happen. Those are some of the ideas that we're thinking of locally around Central Community Service Organization, which I'm a part of, and also the 50th Chicano Moratorium Organizing Committee, which I am also a part of. And I do have to say that even though International Workers' Day is going to be a little bit different this year, that's when we normally come out and push demands that are relevant and important to the working class of this country. We are still thinking of different people who are currently still doing activism despite COVID-19. And some of those folks are people up in St. Paul who recently had a caravan or a drive, kind of like a drive with different people who had posters demanding that they close the detention camps. And I thought that that was such an awesome idea. If you haven't seen it, you should check out Fight Back News. It's on the front page of Fight Back. You can read all about it. And speaking of, one of the biggest things that we are fighting back on is making sure that people in detention centers and in concentration camps are also safe against this very real danger, which is COVID-19. One of our recent statements was around Legalization for All's network, which I'm also a part of, and you should be too, where we issued a very concise and list of demands that included release the undocumented from the concentration camps. If they do not have COVID-19, then why do we have them locked up where they could potentially get COVID-19? And as of today, there is somebody who tested positive, a 31-year-old Mexicano in New Jersey, where a medical employee actually had just also tested positive for COVID. And supposedly he is being taken care of and he's quarantined, but they couldn't tell us where he's being taken. And that is why we are pushing for them to be released, because if you are in a detention center or in a concentration camp, you hardly are being given information on what they're going to do with you and where they're going to place you, and much less do they give this information to your family or your loved ones. So why have them locked up? That is one of our most basic demands. And as we know, the Central American refugee caravan just recently happened. It happened not even a couple of months ago, back in November of 2019. And so all of these thousands of people are currently locked up at the border. And that is just a recipe for disaster. And we hope that local politicians will take this up. If you are looking for something to do locally, pick up your phone, make some phone calls, and demand that the local undocumented people be taken care of, that they also be tested for COVID-19, and if they have nothing, to be released. But if they do have COVID-19, then demand that proper medical attention be given to them just like anybody else. This country is far, far from the bastion of what needs to be done when there is a global pandemic, despite it being one of the richest countries in the world. And I have to look at countries like Venezuela, countries like China, countries like Cuba, that are making sure that people are medically treated as soon as they have any kind of indication that they might have COVID-19, or like Cuba, sending their doctors to Italy to make sure that people get the proper medical attention that they deserve. Make sure that you keep demanding what you can locally. There is so much going on around this pandemic, and I hope that you all stay safe. Viva Aslan.
The state of the economy, take two. If you look at the newspapers or listen to the news on the television or internet today, a lot of it is focused on the stock market. It's been going up, it's been going down, mostly down, and making big moves, but the stock market doesn't really represent how the economy is doing. Half of all Americans don't own any stocks at all, and of those who do, half of all stocks are actually owned by the top 1%, or what we call the monopoly capitalists, those who own and control the big corporations, the Bezos of Amazon, the Zuckerbergs of Facebook, the Bloomberg, who spent nearly $1 billion trying to run for president. So it's what the stock market represents is their wealth is on the line. What economists feel is most important in judging the state of the economy are jobs. This is the most important measure when determining whether the economy has gone into recession or not. And there will be a jobs report coming out on the first Friday of next month for the month of March. So that'll be Friday, April 3rd. So that's a ways away. But there's another measure which isn't quite as accurate as the jobs report, but it'll give us sort of a view of what's going on more quickly, and that is the weekly report on applications for unemployment insurance. Last week's report, which comes out every Thursday, so there'll be another one out Thursday morning, saw the number of unemployment insurance applications jump by 1/3 over the previous week. And estimates earlier this week were maybe there could be another 8-fold increase to 2 million. And then yesterday there was 3 million, and today I heard 4 million. And these estimates just seem to be going up because, for example, California is estimating they're going to report 1 million new applications for unemployment insurance. So that's 1 million people just in California who have lost their jobs over the last week. So in the discussion on Thursday, I will know about that and talk a little bit about it. The other reason I personally think that jobs are more important than the stock market is for 90% of households in the United States, we earn our living by getting paid for wages or a salary by someone else. We're employed by a company or a corporation or a small business or the government. And so day to day, week to week, month to month, year to year, what really matters is whether we have a job and what we are being paid. And this is because this is the vast majority of the people, I think it's a more important measure of the economy in terms of people's well-being than the stock market. So what's going on? There's an economic bill in the relief bill trying to pass through the Senate. The last I heard, this is Wednesday evening, is that it's being held up by the Republicans who feel there's too much unemployment benefits in the bill. And while I am personally glad of the increases in unemployment, extending it, increasing the amount, covering more part-time and temporary and gig workers, but the fact of the matter is it's still not going to be enough, and it's much less than the unemployment that is being covered for many workers, for example, in Europe. Now, why are the Republicans doing this? Well, a lot of them are sort of, they use the free market argument that if you pay people who are not working, that will make them lose their desire to get a job. And while you could make some argument about that when the unemployment was really low, as it was just a month ago, but in times like today where a lot of people, the jobs have disappeared because businesses are closing down, or people can't go to work because their kids are at home and they because the schools are shut, or because they're sick and or they've been in contact with someone who has the COVID-19 and they're trying to self-isolate. It's not a matter of incentives, it's a matter of trying to maintain their income so that they can pay their bills. A lot of people are worried about how are they going to make the rent, or how are they going to make the mortgage. And what the Republicans want to do is give every household, or almost every household, 80, 90% of them, a $1,200 grant per adult, plus extra for children. And the problems for that are numerous. One is the last proposal I saw, and things may have changed, they change hour by hour, would give people who haven't filed for haven't filed for income taxes, which is almost half the population, they would only get half as much, $600 per adult, than people who do file. And then for many of us who do file, like myself, I'm still working. I may be working more because I have to put all my classes online, but I have a paycheck. I'm not worried about paying the rent or the mortgage or my bills. And so why should I be getting, well, actually my household would be getting $2,400. It's really, in my view, more of a political thing to curry favor for the Republicans and the Trump administration than really helping people who need it the most. There's another problem with cash grants. They don't really work to help the economy that much. The Bush administration did this in 2008, and it didn't forestall or even lessen the recession, or a few months later there was the whole financial crisis. So it really doesn't work. The money would really be better spent going to the people who are in need because they can't work, they lost their jobs or had their hours cut, or their living has been reduced, for example, if they're self-employed like Uber and Lyft drivers, etc. The other problem with the Republicans is they're going to be putting hundreds of billions of dollars into corporate bailout. And again, the problem is many of these corporations don't need it. So, for example, I just read this morning that Chevron Corporation, one of the big oil companies, they've been under pressure because oil prices have fallen dramatically since the beginning of the year, partly because of the economic crisis, partly because of a price war between Saudi Arabia and Russia. But what they're doing is they're cutting back on investment and to maintain their dividend payout to shareholders. And so even though they might say that they have restrictions on stock buybacks or other factors, the purpose of for-profit corporations is to reward their shareholders, and they are going to expend a lot of time and effort figuring out how to do that. Other companies like General Motors has up to 5 months in cash available, even if it has to shut down. Now, how many households have 5 months of reserves that they can pay their rent and other bills for 5 months without any income? Very few. In fact, 40% of all households can't even afford a $400 bill. And no matter what they say, the last time they gave bailout to the big auto companies, they said they'd pay it back. But then a few years later, when the economy wasn't in crisis anymore, GM went, let's just, forget about the money we owe. And the Congress went ahead and canceled the rest of the money that they paid back. So they never paid back everything. And that's another problem. It can always be Congress, even though if they set different requirements for payback, they can always change their minds down the road. Thank you very much. Good evening.
So to report at this point in time, I'm recording this at 4:30 p.m. Eastern on March 25th. There are over 64,000 confirmed infections in the United States, with approximately 901 people dead. There is still no state of a national lockdown. And of course, Trump has started making noises about opening businesses back up by Easter, April 12th, which is honestly would be criminal at this point in time, this early on in the pandemic. But, his administration has been putting profits before people. So, that kind of falls in line with his approach. And on a state level, too, there has been no stay-at-home order or shelter-in-place order from Governor DeSantis. Governor DeSantis, who is a Republican who was endorsed by Trump during his run for governor, actually, and has made a lot of racist comments towards the opposition, Andrew Gillum, that DeSantis has been resisting every action of putting a stay-in-place order, despite the fact that about 23% of the population are people older than 60. There's a huge community of retired people in the state of Florida because of the weather. Despite the fact that there's community spread in multiple cities, including cities that have all those retired people, and despite the fact that Florida is consistently ranking somewhere between the 5th to today it's the 8th highest among states with infections in the U.S., or highest number of infections among states in the U.S., and that's without universal testing. So, it's really that, the numbers are pretty high and higher than we'll know at this point in time. And in fact, there's actually a huge struggle right now against the rich who want to salvage their profits from the economic crash, and against the working people who are, making it clear that we need the protective equipment that we need, and that, we need to take these measures seriously. And it's reflecting on the municipal level as well. Mayor Jane Castor is pushing really hard for there to be a shelter-in-place order, but she was outvoted by the Hillsborough County representatives on Monday, who are actually all full of business people. So, everything from business people who sit on the board of Tampa General Hospital to people who run investment advisory firms. Those are the people who said that we should stay out, there should be no shelter-in-place order. And put the most that they've proposed is a 9 p.m. curfew, which we know at this point in time is not enough. So, there's that fierce struggle going on here. There's going to be another vote tomorrow, Thursday. So we'll see how it goes. But, they really are looking to get more and more people sick if it means they can get their profits back. And that's just like a little example of what's going on a national scale. So as far as what's going on with students with whom I organize, this has definitely interrupted and cheapened and downgraded their education on a huge scale, and really showed that education is not that, it's almost as low as healthcare in the eyes of the Trump administration. Instead of practicing social distancing back in January, most schools waited until the last minute, March, to go remote, and in doing so, they have neglected to make sure students all had laptops and internet access, such as the case of the University of North Florida, or they forcibly pushed students out of housing without providing any kind of economic relief or alternative, such as at Kent State University. Right now, a lot of student organizers in Students for Democratic Society are going to be organizing or are organizing around these issues. Everything from, in some places, in-person protests, which have stopped recently, to call-ins and social media blitzes. So we encourage everyone to take part in this, calling for an end student evictions, pay for the federal student workers who can no longer work. And it's showed that in the eyes of the Trump administration, education is almost as low on the bar as healthcare. So Trump wants to blame China, and we know that it's his administration that is really clearly to blame. But this is part of his racist playbook. He should have used the time and the warning that we had about the virus to universalize testing, make sure workers had paid sick leave, getting the hospital equipment that we needed, but instead he wants to point the finger at the People's Republic of China and even Asian Americans here in the United States. And he has, his racist playbook has included emphasizing that travel bans are the most important thing instead of getting hospital equipment, shutting borders, measures that we see now have been ineffective, and of course has been pouring trillions of dollars into Wall Street. But it's ironic because he wants to point fingers at China, but China has managed to stop the spread, whether no matter what you think of the politics of what we view as the socialist government of China, it cannot be denied that they pulled out all the stops to stop this virus and to get everyone all the healthcare they needed, constructing emergency hospitals that were two-story buildings and not like little, testing facilities out in the field, increasing production of the hospital equipment that they needed by at least 6 times, even sending out groceries to quarantined areas. They took it very seriously, which we do not see the Trump administration doing. And as a result, Americans now worldwide are more likely to infect people than Chinese people. Americans, the American hospitals, with the help of the Trump administration, are less capable than the ones in China of dealing and treating the virus because of the impending shortages of equipment and beds. So really, his logic makes no sense, and it is just a classic example of trying to stoke racism and looking for a scapegoat. And the fact of the matter is, this xenophobia has a context, right? It's been his favorite tactic of rallying together his racists, and his scapegoating technique is very dangerous. And it's not new to the coronavirus pandemic either. Since 2019, Trump's administration has been in a trade war with not only Canada and not only the UK, but also with China, levying tariffs on imports. He's been steadily increasing immigration restrictions, making it harder for Chinese immigrants to come into the United States even to do research, and going so far as to deny visas to professors and to graduate students. So to Trump, who has shown that he's willing to sacrifice working people in the US for profits blipping up a little bit on Wall Street, the coronavirus is another tool that he can use to stoke racism against the Chinese and to beat the drums of war. As an Asian American person, I'm Filipino, I'm not Chinese, but his ignorant self does not make the distinction. But as a Filipino American, I've had several negative experiences so far of people glaring, or one time a man even covering his face. And my coworkers who are Chinese American at one point returned to their car to see that napkins were stuffed in the door handle. And frankly, this is disgusting. In the month of March alone, the Trump administration has taken advantage of the situation to launch investigations on 180 Chinese scientists who the charges were bogus. Oh, they had affiliations to Chinese universities. Well, I mean, if that's where they trained, yeah, so it's bogus charges and just an effort to continue expelling Chinese people from the U.S. And we know where this approach leads. We know what the end game is. We know that it's not good for working people in the U.S., for the U.S. to have another war and to destabilize another country for their markets. It's only good for the fat cats on Wall Street, the same people who are willing to let us all die, and we can't allow them to win. We know that at the end of the day, We need to beat Trump's senseless, racist, white supremacist narrative. We need to show solidarity with working people around the world and with revolutionary governments around the world. We know that ultimately it's working class people who are capable of handling this pandemic and not the billionaires for whom Trump foots the bill, and we're willing to fight for it. We're here to organize for what we need, and in the long run, we are looking to advance the fight to overthrow the system that puts profits over people. And we're done asking. We don't want to end up like Italy, but if we do, we will never forgive nor forget. We can't let Trump make us forget that ultimately it's his administration that doomed us all, and we're not going to stop fighting for a better world, one that has no room for parasites like Donald Trump.
This pandemic lays bare the failures of capitalism as a system that has as its basis the ever-expanding need for profits. We can also see the absolute lack of a safety net that exists in this country. This is a system where the elites, the 1% or the bourgeoisie, are criminally unwilling to put people before their need for profits. We saw this with the first concern of Trump and their cronies was bailing out Wall Street. Several weeks ago, the Freedom Road Labor Commission issued a statement putting forward immediate demands for the labor movement. Those demands are: 1, to close all non-essential services. This is a worldwide crisis and needs to be treated as such. Secondly, no worker shall suffer loss of income due to this crisis. We didn't create it, and we shouldn't have to pay the price for it. Third, every worker who is forced to work because they're in an essential position needs to be safe. Fourth, every worker who's forced to work also needs hazard pay. We also support the additional demands that are being put forward for society as a whole. These include demands for full and free testing and medical coverage for everybody who's affected by this crisis, child care for essential workers, a moratorium on rents and mortgages, student loans and other loans, utilities, etc., and an end to ICE raids and deportations. We need to put forward demands for all workers and all working people. So the demands that we have for the labor movement include shutting things down that are non-essential services. And this is incredibly important. What we see from all of the public health data, all of the science data, what we see from our lessons from China and Vietnam, that what works is shutting the system down. We need to be able to do that, especially to protect the most vulnerable workers and families. It's amazing, though, how many employers are resisting calls to close down temporarily in order to protect society. We see factories that sit idle while they have a surplus, and they're fully willing at that point in time to furlough workers and lay them off, etc., but they don't want to sit idle now. Why is that? Because they know that their profits come from our labor. And yet what they're doing is managers and CEOs, while they sit isolated at home trying to protect themselves and their families, they want us to keep working. They are willing to risk that some of their workforce will end up dying in order to ensure that they keep turning a profit, and this is criminal. Secondly, we need to ensure that there's paid pandemic leave, that there's no loss of income whatsoever for any worker who is unable to work because they're homesick, because they're home taking care of their kids, because they've been laid off, because they've been furloughed, because businesses have closed down necessarily in order to fight this pandemic. We need to ensure that no one loses their income as a result of that. And either the employer needs to pay people or the state needs to pay people with 100% unemployment. Again, working people didn't create this crisis, and we shouldn't have to suffer financially as a result. We also need to ensure that there is a safe working environment for all of those who are forced to work during this pandemic. The negligence of many employers, especially in the healthcare sector, is criminal in my opinion, and shows again the failures of this system. On the front lines, we have healthcare workers who are fighting every day. These people are heroes who are fighting to save us and our families, and yet they don't have enough N95 masks. They don't have enough personal protective equipment. And we have to ask, why is it that hospitals don't have these supplies? It's because they put more attention to their profit margins, and they would rather run out or come close to running out than have a surplus. We've heard demands for years from nurses and other healthcare workers who've said that they don't have safe staffing levels, and it's coming home to roost right now in the lack of safe staffing and the lack of staffing in the healthcare sector. And we need to be clear, healthcare is a fundamental human right, and we need to ensure that those who are taking care of us, who are taking care of our sick family members, sick members of our society shouldn't have to give up their lives in order to save the lives of others. We need to ensure that all workers who are forced to work, whether in the healthcare sector or not, if they're forced to work during this pandemic, have the proper safety equipment, that they have sanitized workplaces, personal protective equipment like gloves and masks and hand sanitizer. And for anybody who's forced to work during this pandemic, if you contract COVID-19, I say that you need to file a workers' comp claim immediately because your employer is responsible for you contracting this. We also need to ensure that there's hazard pay. Nobody should be profiting from this pandemic, and anyone who is forced to work during this pandemic deserves hazard pay and so much more. All workers who are forced to work should be compensated for risking their lives. What we've seen during this crisis is that it's already been felt unevenly. We know that service and hospitality industries have been devastated. 90% of the layoffs and job loss, or 90% layoffs and job loss has taken place in the hotel and restaurant industry. We know that there's a real gendered and racial impact of this as well. The vast majority of service economy workers are women and people of color. In Minnesota, the stat that I saw said that unemployment claims are 60% of them in the last couple of weeks have been filed by women. We know that those who are on the front lines of risking themselves in order to keep the rest of us healthy and take care of us in the healthcare sector, in nursing homes, and child care providers, grocery workers, etc., that these are predominantly jobs held by women and people of color, and that unless they're unionized, they tend to be low-wage jobs with little or no benefits, and we need to protect all workers in carrying out this work. What we also know and what we've seen is that unionized workers, especially those who are in fighting unions, have made early wins on fighting for these demands. People have been able to have won the ability to work from home, have won paid leave if they're not able to work from home, have won hazard pay. What we've seen is workers who are taking collective action, whether they're in unions or not, if they stand up and say, we're not going to pay for this crisis with our lives, we won't risk our lives for your profits, have been able to win safer workplaces. And we've seen this at Purdue, we've seen this with bus drivers, we've seen this with trash collectors, workers at Domino's who've walked off the jobs and said, no, we need to be safe. So what we know is that when we stand up and fight together, we're really going to win safe workplaces, and we're going to win protections. What we also know, and what unorganized workers are now learning, is the power of solidarity and collective action. And what people, I think, all over the country are learning is that labor creates all wealth, and we need to really look at that. We know that there are challenges ahead. We know that there will be mass unemployment with this economic crisis that's coming, with a recession or depression. And we know that they're going to try and balance the budgets on our backs. We know that they're going to try and take automation and other things that we've been able to develop in order to work safely during this time. They're going to turn it on us, and they're going to try and use online teaching, automated delivery, etc. And we're going to have to fight to make sure that workers' rights and workers' livelihoods are protected. But first, we need to do all that we can to reduce the number of deaths and illnesses, because we know that this pandemic is going to be most felt by the lower sectors of the working class, who are the most vulnerable. And a longstanding tenet of the labor movement is that an injury to one is an injury to all. So we need to stand up and fight for each other. We need to stand up and make sure that everybody is fighting for your families, for your coworkers, for your communities, and for the working class as a whole. And that when we stand together in solidarity, there's nothing that we can't win. What we know is that another world is possible and another world is necessary, and we need to fight like hell for it now.